Hi, good evening. I'd like to welcome you to Poem Praise 2 and peace and blessings be upon you and your family this evening. Now, what I have for you this evening is we're going to go ahead and get into Sacred Woman. Chapter 4, The Care of the Womb. We are now in take 3 of this chapter. So, do you have 15 minutes? Just 15 minutes of your time is all I ask this evening. Well, without further ado, let's go ahead and get into take 3, which I'm going to just give you a little preview of where we're about to go into. Right now, we're talking about the female reproductive system and the common manifestations of womb imbalances or illnesses. Sexually transmitted diseases, vaginitis, and inflammation of the vagina, usually caused by bacterial or yeast infection. The symptoms and signs: vaginal burning or itching or discharge, and yellow or white foul smelling discharge. Bacterial vaginosis. Bacterial vaginosis results from overgrowth of particular vaginal bacteria. The prevalence of bacterial vaginosis is higher in African American women. Bacterial vaginosis has been associated with the use of some genital cleansing products, douche. It can lead to low birth weight and preterm delivery, premature birth. Chlamydia, a bacterial infection that occurs primarily in the cervix in women and the urethra in men. If antibiotic treatment is not prescribed, it can lead to infertility in both women and men. Genital herpes, a sexually transmitted virus that appears around the genital area. Symptoms and signs include burning, itching, and the appearance of painful blisters. There is no cure. Therefore, treatment is designed to relieve discomfort and prevent bacterial infection. Gonorrhea, one of the most common STDs, a bacterial infection that causes inflammation of the glands. If left untreated, it can cause pelvic inflammatory disease, PID. Infertility or ectopic pregnancy. Treatment includes antibiotics. However, there are some strands that are resistant to treatment. Syphilis, a bacterial infection that multiplies rapidly in the body. It begins with a canker in the genital area. Left untreated, syphilis can result in serious symptoms, from fever and headache to bone pain, mental deterioration, and even death. Syphilis can be treated with antibiotics, but it cannot be cured. You must see a doctor for treatment. Reproductive system disorders. Endometriosis. The endometrium is made up of cells that create the lining of the uterus. These cells can break away and grow inside the uterine cavity, implanting themselves within the pelvis, ovaries, appendix, bowels, and our bladder. Symptoms and signs: menstrual cramps, chronic pain, pelvic scarring, and adhesions within the womb may be associated with infertility. Fibroids, a mass of rapidly dividing cells that invade surrounding tissues. These cells rob neighboring normal cells of their nutrients. So like a battle with the cells going on in the body with the fibroids, because that's interesting. You got one cell robbing another cell of the nutrients in order to grow. Symptoms and signs: pain and cramping, unusual bleeding or discharge, clotting, severe menstrual cramps. So not chronic like endometriosis. With the fibroids, they're severe menstrual cramps and can lead to miscarriages. Genital prolapse, uterus, a condition in which weakened pelvic muscles fail to hold the uterus and other pelvic organs in place, often due to prolapsed, impacted colon or complications from labor and childbirth. Symptoms and signs: weakened vaginal and bladder muscles, frequent urination, low back pain, abdominal pain, may result in infertility, blocked tubes, and miscarriages. Pregnancy health. Pregnancy associated hypertension. Symptoms may include sudden elevation of blood pressure, headaches, visual disturbances, bloating, protein in the urine, can result in the death of both fetus and mother. Miscarriage, spontaneous abortion. When a pregnant woman delivers or loses a fetus before the 20th week of pregnancy. Spontaneous abortion may result from infections, nutritional deficiency, structural or chromosomal abnormalities, diabetes, drug use, excess stress, and unknown causes. Preterm delivery, premature birth. Birth of a premature infant between 20 and 37 weeks old. The cause of preterm delivery is often unknown. Risk factors include untreated bacterial vaginosis, poor nutrition, and previous preterm birth. Menopause. Menopause is not an illness or any form of disease, but rather it is a part of a woman's natural life process. It is a period of glandular changes that indicate the end of a woman's menstrual cycle. It signals a time when a woman has the privilege of keeping her wise blood and shifts her perspective to make her voice heard in the larger community. Menopause is brought about by decreased production of the female sex hormone. It generally occurs between the ages of 42 and 52, but premenopausal symptoms can begin as early as 35. Symptoms and signs. While menopause is a natural part of our cycle, the indications that this is happening can be an easy, gentle process, or it can be a difficult time. Those women who eat poorly, do not get enough exercise, and live a stressful lifestyle may experience some or all of the following symptoms: severe nervousness, irritability, depression, overexcitability, headaches, abdominal pains, rushes of blood to the head and upper body called hot flashes, backaches, leg cramps, night sweats, and nosebleeds. However, we have the power to prevent or heal ourselves of these various toxic symptoms by eating live foods and fresh fruit, by drinking fresh fruit and vegetable juices and herb teas, by maintaining a clean colon, by exercising and meditation daily, and above all, by healing or releasing all negative relationships and getting them out of our lives. Next we have is the womb wellness profile. Now this is actually a part of the book where one would be able to actually write in the book or actually take notes, as you see right there. So we have a little time. Yeah, we do. So I'm going to just read this introduction right here. It says, the following womb wellness profile has been divided into 6 categories of wellness that will help you assess the current health of your womb. This profile will aid you in your quest for womb wellness because it helps you keep an accurate record of your womb health over time. It is suggested that after you record your current baseline, you continue to monitor your womb wellness for a minimum of 6 cycles, 6 months, okay? To get a clear picture of the state of your current menstrual period, you need to consider the intensity of the flow, i.e. light to heavy, clot-free or clotting, odor-free or menstrual odor, and the number of days your menses last, i.e. optional, 1 to 3 days, average, 4 to 5 days, may mean the womb is already in a disease state, chronic, 6 to 10 days, and beyond. So complete the following information about your menstrual cycle, no matter where you are in your reproductive years, childbearing years, or menopausal. Date of your first menstrual cycle, number of days in a cycle, length of your menstrual flow, the number of days. Directions for rating womb wellness. Use 0 to 3 to rate the items on your womb wellness profile. Use 0 if the condition never existed or no longer exists. Use 1 if the condition occurs infrequently. Use 2 if the condition occurs frequently. Use 3 if the condition is serious health challenge. For example, endometriosis, cervical cancer, etc. Or if you have had a traumatic womb episode. For example, rape, childhood molestation, and abortion. Category A. These are broken down into different categories. We have A, B, C, D, and E. Now, for my next take, we're going to certainly break down the categories, and I'll turn the page. There's another category, F. So we go from menstrual health, vaginal health, sexual health, pregnancy health, menopause. So it's breaking down the sections we just read, and common illnesses. So, and then there's actually some scorekeeping regarding that. So for our next take, when we actually go into that part right there, that's going to be on take number 4, okay, here on Poem Praise 2. But until then, I certainly want for you to be well, to take care, to be safe, be blessed, and it be at thy will. I will talk with you soon here on Poem Praise 2. Till next time. Later, y'all.